Welcome back to Coursera and the anatomy of the upper limb. This is lecture 11. Now let's extend our conversation that we began last time about the muscles that are acting at the shoulder joint to include muscles that are acting in the coronal plane at the shoulder joint. And these actions, as indicated on this picture that we've looked at previously, will include muscles that abduct the arm at the shoulder, pulling it away from the midline axis of the body in the coronal plane, or muscles that have the antagonistic action by returning the upper limb to the anatomic position by adducting it. So if we look at our chart, we can see that there are going to be two muscles that play a major role in abduction. And there are a series of muscles, three of them, that are going to play a major role in adduction, adduction being assisted by gravity. So even though we have listed our two abductors on this chart, we need to make a distinction. The supraspinatus muscle is one of our four rotator cuff muscles that we identified as being SITS, and this was the first S. But it turns out now that the supraspinatus is not a muscle that is capable of rotation of the arm at the shoulder. It is a muscle which abducts. But note that the supraspinatus muscle is going to be a better abductor to the first 15 degrees of abduction. So we kind of say that the supraspinatus initiates abduction of the arm at the shoulder. Then, after the first 15 degrees of abduction, the middle fibers of the deltoid will take over, and really both muscles will take the arm through a total range of over 180 degrees of abduction. But the supraspinatus is more active early, the middle fibers of the deltoid are more active later. Note that again, this action basically is being controlled by the proximal segments, the upper segments of the spinal cord that are basically found in most of the nerves that are innervating muscles that are acting at a proximal joint, the shoulder in this case. All of the fibers of the deltoid, of which they have many actions as we have seen and will see, are innervated by the axillary nerve, whereas the fibers of the supraspinatus are innervated by the suprascapular nerve. Then the muscles that act to adduct the arm at the shoulder will be the sternocostal portion of the pectoralis major, innervated by both medial and lateral pectoral nerves, and again the fibers of our interesting pair that work together to perform a series of three actions, the latissimus dorsi and the teres major. We've already seen these two muscles acting in concert to produce arm extension at the shoulder. Now they're also going to play a role in adducting the arm at the shoulder. And lastly, we're going to see them helping to medially rotate the arm at the shoulder. Latissimus dorsi being innervated by the thoracodorsal nerve, the teres major by the lower subscapular nerve. Again, named branches that come off the proximal portion of the brachial plexus, innervating proximal muscles, largely before the brachial plexus gave rise to those major five nerves that innervate virtually all of the muscles of the remaining portion of the arm, the forearm, and the hand. So let's look at these specific muscles. Here is a wonderful view of the entire deltoid from the lateral aspect. And as we've already seen, and anatomically, we can subdivide the deltoid functionally, even though it is a broad muscle that really forms the bulk of the contour of the anterior, lateral, and posterior aspect of the shoulder. Functionally, we can subdivide the deltoid into anterior or clavicular fibers that played a role in flexion of the arm at the shoulder. We can add the posterior or fibers that are attaching to the scapular spine. We saw those in our last hour as muscles that played a role in extending the arm at the shoulder. Now we're adding the fibers of the middle portion of the deltoid playing a major role in abduction of the arm at the shoulder, certainly very capable of pulling the humerus up in the coronal plane and therefore abducting it. So again, another example of a very broad muscle like the trapezius, that had different parts that were capable of performing different actions based on the direction and the attachments of their fibers. Then, here is a view of our rotator cuff again. We identified these four muscles previously as including the supraspinatus, the infraspinatus, the teres minor, and the subscapularis, and we said they were muscles of the rotator cuff, but here's the exception. The fibers of the supraspinatus are not acting as a rotator, but as an abductor, because they are crossing directly over the top of the glenohumeral joint, and they will be in a position basically to abduct the arm of the shoulder, largely by initiating it, playing a major role in the first 15 degrees of abduction, and then after that the deltoid fibers will become more active. So the supraspinatus has another claim to fame. Many of you out there have known someone or either have had a rotator cuff tear, stretch, or strain. Turns out that it is the fibers of the supraspinatus that are the most frequently torn or stretched in a rotator cuff injury. And think basically of the key role played by these fibers. They initiate the abduction of the arm basically in any athlete, pitcher or quarterback, that is cocking their arm by laterally rotating the arm at the shoulder and then propelling some sort of spherical object forward by medially rotating the arm at the shoulder and utilizing other joints of the upper limb. But again, those actions, when you propel an object forward, pitching a ball, occur when the arm is partially abducted at the shoulder by the supraspinatus and assisted by the deltoid muscles. So it's really an overuse injury that tends to tear or strain the tendon of the supraspinatus as it crosses the superior aspect of the glenohumeral joint. Then, if we look basically at the muscles which are adducting the arm at the shoulder, these again will be probably both fibers of the deltoid. They're in a position posteriorly and anteriorly to adduct the arm at the shoulder, as are the fibers of the teres major and the latissimus dorsi. So they were equally in a position, as was the deltoid, to extend the arm at the shoulder. Now we can say that the same parts or muscles are performing a similar role in adducting the arm at the shoulder, as we saw when we looked at that chart of muscular action. Now let's consult our digital atlas, because now we can see very nicely from a posterior aspect the middle fibers of the deltoid. There they are, acting to abduct the arm at the shoulder, basically throughout the range of motion beginning about 15 degrees. And we can see right there the fibers of the supraspinatus helping us to initiate abduction by being more active at the earliest stages of adduction. And if we kind of roll this over like this from the top, you can see quite clearly how the middle fibers of the deltoid and the supraspinatus are acting in concert, supraspinatus first, then middle fibers of deltoid later, to certainly move the humerus at the glenohumeral joint in the coronal plane. And you can see basically a nice view of the actions of those two muscles, obviously the deltoid being controlled by the axillary nerve and the supraspinatus being controlled by the suprascapular nerve. And then the antagonistic action, if we go to that, we can see the muscles, and they're more numerous, that are playing a role in scapular adduction. Now, we don't show the posterior fibers of the deltoid because they have been removed, but they would overlap basically the fibers of the rotator cuff muscles. So we can see the infraspinatus and the teres minor muscle. Those muscles are playing a role mainly in shoulder lateral rotation, but the more active muscles playing a role in shoulder adduction are the teres major fibers that share an attachment with the fibers of the latissimus dorsi on the anterior aspect of the humeral shaft. So they, along with the posterior fibers of the deltoid, are going to be good adductors. But if we roll the arm around to the anterior side, we can see the broad fibers of the sternocostal portion, mainly of the pectoralis major. This illustration shows the entire muscle, but it's really those sternocostal fibers that are playing a major role in adducting the arm from the anterior aspect by pulling the arm back again in the coronal plane. Basically, you can see these muscles acting from above by pulling the arm back in the coronal plane. First, the fibers of the sternocostal head of the pectoralis major, and then certainly the fibers of the teres major and the latissimus dorsi, as illustrated from below. Now, let's finish the muscles that are acting at the glenohumeral joint by looking at muscles that are performing lateral versus medial rotation. Obviously, very important actions, as we've indicated, when you are propelling some sort of spherical or oblong object in a baseball pitcher and obviously a football quarterback. So this motion is going to play a key role in propelling that object forward, as well as will be flexion and extension of other joints of the upper limb. So let's look at our chart, because our muscles that laterally rotate the arm at the shoulder in the horizontal plane will again be the posterior fibers of the deltoid, and literally, as their name implies, it's about time they got some press, two of the muscles that make up the so-called rotator cuff, the infraspinatus and the teres minor. Then on the medial rotation side, we have lots of players. Pectoralis major, which we just identified previously as an adductor of the arm at the shoulder, at least part of it. Again, the latissimus dorsi and the teres major playing a role. The anterior fibers of the deltoid, and one more, the last of the rotator cuff muscles, the subscapularis. Again, a variety of nerves innervating these muscles, but again, the theme is mainly the C5 and C6 spinal cord segments that are controlling a group of proximal muscles that are acting on a proximal joint in the upper limb. So again, looking at this globally, we can see that a number of the muscles that are crossing or acting at the shoulder joint are performing more than one action. We can see the broad fibers of the pectoralis muscle playing obviously major roles in flexion of the arm at the shoulder, in adduction of the arm at the shoulder, and in medial rotation. And we can group the fibers of the latissimus and teres major together because they together perform the same three actions. They extend the arm at the shoulder, they adduct the arm at the shoulder, and they also, as we've just seen, will play a role in medial rotation of the arm at the shoulder. So it makes it a little easier to remember if we group their fibers together. And again, the deltoid, kind of like the trapezius, has different components. In this case, anterior or clavicular fibers, posterior fibers, and middle fibers. The anterior and the posterior fibers play a role in flexion extension as well as in lateral and medial rotation. The middle fibers, their singular role, and a very important one, is to act as the major abductors of the arm at the shoulder joint. So let's look at our lateral and medial rotators, because finally we can define the other actions of the rotator cuff. Note again that the rotator cuff tendons, you can kind of see it here, are playing a key role in maintaining the stability of the head of the humerus by enforcing the joint capsule superiorly, posteriorly, and anteriorly, but not inferiorly. So again, you can see that the SIT component of the rotator cuff, the supraspinatus, the infraspinatus, and the teres minor, have broad attachments to different facets on the greater tubercle of the humerus, whereas the subscapularis is the only rotator cuff muscle that attaches to something called the lesser tubercle of the humerus, and the greater and lesser tubercles are separated by a shallow depression called the intertubercular groove that's traversed by the long head of the biceps brachii as it crosses the shoulder joint inside the articular capsule from the supraglenoid tubercle down, crossing the humerus, and actually, as we'll see, crossing the elbow joint as well. So here are the muscles. Again, now we can identify really the major role played by rotator cuff muscles. We've already eliminated that as being an abductor, but you can certainly see in this view from above, and we'll see it on our digital atlas, where the infraspinatus and the teres minor are in a position to laterally rotate the arm at the shoulder, whereas the subscapularis, being in an entirely different position, is going to be much more of a medial rotator of the arm of the humerus, kind of defining this rotation as moving a midline axis going through the anterior portion of the humerus and either rotating it laterally in the horizontal plane or medially in the horizontal plane. So certainly it's really 3 out of the 4 rotator cuff muscles that are actually acting to rotate in one direction or the other. The supraspinatus is an abductor, as we've already seen. Then, just another view of the rotator cuff. In this cutaway view, we can see the cut fibers of the supraspinatus crossing the superior aspect of the joint, and therefore acting as an abductor. But the fibers of the intraspinatus are largely blended with the fibers of the teres minor, crossing the posterior aspect of the joint, both of them acting as lateral rotators. And note the teres major. The teres minor and major kind of share an origin from the lower lateral portion of the scapula, but the two muscles diverge as they approach the humerus and pass on different sides of the long head of the triceps. The teres major attaching to the anterior border of the humerus and therefore acting mainly as a medial rotator, but the teres minor attaching to the posterior aspect of the humerus and acting as a lateral rotator, because these two muscles diverge as they pass on different sides of the long head of the triceps brachii. Then a brief perspective of innervation. I can erase this here and show that certainly the innervation and blood supply to both supraspinatus and infraspinatus is provided by the suprascapular artery and nerve, whereas the teres minor shares its innervation with the deltoid that largely covers it by the axillary nerve. Teres major by lower subscapular, basically not really shown on here obviously as accurately. And the last of the rotator cuff muscles, which we really can't see in this view, is on the anterior aspect and crosses the anterior aspect of the glenohumeral joint. Then we can see our medial rotators. Again, deltoids, clavicular fibers could act in that capacity. The fibers of the clavicular head, or probably the entire fibers of the pectoralis, because of their anterior attachment on the humerus, can roll it basically in a position of medial rotation, along with the subscapularis muscle, which we can't see in this view. Then we can see the additional medial rotators are the teres major and the latissimus dorsi. It certainly doesn't look like they're in a position to do that, but both of the fibers of these muscles sweep basically underneath the axilla, forming part of its posterior wall, and attach to the anterior portion of the shaft of the humerus. So when they contract, they pull the anterior midline of the humerus medially and medially rotate. And we've kind of documented the relationship of the teres major below to the teres minor above, and you can see that muscle crossing on the opposite side of the long head of the triceps brachii. Now let's look at our digital atlas, because we can see muscles that are playing a role in lateral rotation of the arm at the shoulder. Can't see it too well, but you can certainly see the forearm being rotated along with the action. So again, our lateral rotators include the posterior fibers of the deltoid, but include muscles that are largely hidden. Basically hiding under here would be the teres, what would be the infraspinatus first, and the teres minor just below it. Two of our major components, obviously, of the rotator cuff, that are being assisted in lateral rotation of the arm at the humerus by the fibers of the posterior deltoid. And if I kind of tilt this up like this, you can envision that the long axis of the humerus is going into the plane of the screen, and the fibers basically of the deltoid and by the fibers of the infraspinatus, assisted by the fibers of the teres minor, are the major lateral rotators of the arm at the shoulder. And then if we conclude this, we can see the muscles that are playing a role in medial rotation of the arm at the shoulder. And they are certainly shown on the anterior aspect. But again, we see the fibers again of pectoralis major performing that action. There they are, medially rotating the arm at the shoulder. If we tilt it up like that, we can see the action occurring, antagonistic to the lateral rotators. This action is certainly going to be assisted by the anterior or the clavicular fibers of the deltoid. And what we really can't see that well are the fibers of the serratus anterior, which are largely hidden by the fibers of pec major and anterior deltoid. So if I'm going to kind of tilt this enough, basically, I might be able to just see the fibers of the subscapularis. Well, those are the fibers of the latissimus dorsi that are there. We really can't see the fibers of the subscapularis well that are illustrated back. There they are, largely hidden by the chest wall and arising from the fossa of the scapula on the anterior side. There we have a better view of it. And the fibers sweep over, cross the anterior aspect of the shoulder joint, and are in a very good position also to act as medial rotators. And again, back in the back, you can see the fibers of not only the latissimus dorsi, but the fibers of the pectoralis major. If I pick it up, there they are, that are sweeping up in concert with the latissimus dorsi, that are certainly now in a position to assist the subscapularis in medial rotation, along with the more obvious fibers, as we've said, of the pectoralis major and the clavicular or anterior fibers of the deltoid.